Have you ever felt like you're doing everything right? You're taking the right supplements, you're eating very healthy, you're working out consistently, and maybe you're even doing HRT, hormone replacement therapy, but yet your body still doesn't feel quite regulated. Maybe you feel exhausted, inflamed, you're not sleeping well, you're anxious, you might be gaining weight, you might be losing muscle, and you're feeling a little bit disconnected from yourself. One of the biggest problems in healthcare right now is that we often seem to treat what's happening downstream without understanding what's happening upstream. That is huge for me. And when I became aware of upstream regulation versus downstream regulation, it truly changed how I viewed healing. So today, I want to teach you the difference between upstream regulation and downstream regulation, especially when it comes to hormones. Because this may be the missing link as to why your body isn't responding the way you think it should. So let's simplify this. Think of your body as movement down the river. Upstream is the source of the river. Downstream is what happens later. In functional medicine and systems biology, upstream regulation refers to the systems that control and coordinate the body. So that includes the brain, the nervous system, your circadian rhythms, your mitochondria, your stress response, your nutrient status, and your whole sense of safety within your space, within your body. Downstream regulation refers to the symptoms and effects that show up later. So that could include fatigue, inflammation, insomnia, hormone imbalance, weight gain, pain, brain fog, anxiety. And here's where things get super important. Most conventional approaches work downstream. Examples: if you have low estrogen, take estrogen. If you have high blood sugar, take metformin or decrease your blood sugar levels. If you feel inflamed, take an anti-inflammatory. Take some NSAIDs, some ibuprofen, suppress that inflammation. And if you can't sleep, sedate the nervous system, take a sleeping pill. So to be clear, these interventions can work and they can help, and sometimes they're truly necessary, and sometimes they're even life-saving. But if we never do that deep dive and ask the question, why did the system become dysregulated in the very first place, then we'll never truly get back to restored regulation. And this is why so many people get stuck. They keep trying to force chemistry downstream, just putting a Band-Aid on the final problem, while the upstream systems are screaming for support, but they're not being heard. So let's use cortisol as an example of this to bring it home and make it make sense. Cortisol is not a bad hormone. It's called the stress hormone, so people just think it's a bad hormone. It's not. It helps regulate energy, blood sugar, inflammation, survival, and adaptation. But cortisol is heavily influenced by sleep, stress, blood sugar regulation or blood sugar instability, blood sugar levels, I should say, nervous system regulation, trauma, overtraining, circadian rhythms, and inflammation. So if someone has low energy and simply stimulates the downstream regulation of it with caffeine or stimulants, but they haven't addressed the upstream physiology, what's actually causing the shift, the lowered cortisol levels, they may fix the system temporarily, Low cortisol, low energy, give it stimulation, give it caffeine, you feel amped for a while, but it doesn't truly heal because you haven't addressed the why behind the cortisol is even low. The body may be getting into low reserves and low energy because it no longer feels safe. So it's responding to what's going on in the physiology of the entire body. So this is where the nervous system and nervous system regulation becomes foundational in how we view healing. Because the autonomic nervous system affects everything. It affects cortisol, it affects thyroid function, insulin, digestion, sex hormones, inflammation, and even mitochondrial energy production. So a dysregulated nervous system can change hormone signaling before that even shows up in lab results. That's why chronic stress, overtraining, poor sleep, hypervigilance, and inflammation can all create hormonal symptoms. And then when that happens, the body shifts from repair mode to survival mode. Now let's talk about how this affects perimenopause, menopause, postmenopause, and why some women feel quite blindsided by the whole process of hormonal shifting. The downstream model says if your estrogen is dropping, let's just put you on HRT and replace that estrogen. And again, sometimes hormone replacement therapy is amazing, very stabilizing. But what's often missing is that upstream conversation. Why are some people or some women super resilient during hormonal transitions while other women fall off the rails? They simply fall apart. And that's because hormones don't just exist in isolation. They're not just a range that you're looking for to be within in the body. They exist in an environment called our physiology. And that terrain really matters. The things like oxidative stress, how much muscle mass you have, how's your mitochondrial functioning, what's your gut health like, is your blood sugar regulated, and how's the quality of your sleep? Is your nervous system regulated? How's your liver? Is it detoxifying as it needs to? How's your inflammatory load? How's your recovery capacity? There's a lot of questions out there that we can ask and do the deep dive because these all influence the body's experience with hormonal changes because it creates the environment with how we respond. So two women can have the exact same hormone levels, estrogen levels. One can feel vibrant and one can feel like they're simply falling apart. And the difference is the upstream regulation versus the downstream physiology. So this is why random supplementation may not work either. So if you're just taking random supplements because they seem to address what you're feeling downstream, sometimes they work and sometimes they may miss the boat. Kind of like if you're feeling fatigued, can't sleep, digestive issues. If you're taking things like magnesium, ashwagandha, NAC, hormones, adaptogens, thyroid support, adrenal support, but you're not understanding the causation or the deep question, why is your system dysregulated anyway? And you're only using these supplements to treat what's happening downstream, the fatigue, the lack of sleep, whatnot. Sometimes you could actually be disrupting your nervous system and creating more dysregulation because you're just treating downstream and you haven't addressed the main cause. So you need to be careful about that, and that's why sometimes you feel stuck. The questions become, one, Is the body truly deficient and so it needs support with magnesium, ashwagandha, NAD, whatnot? Or is the body simply adapting to something that's happening upstream? Is the body truly lacking the support it needs? Or is it really trying to protect itself? These are completely different lenses that we look through in how we treat the body and restore health. One of my favorite analogies is this. Downstream care is like mopping up water from the floor. Upstream care is figuring out why the sink is even overflowing. Both matter. You still want to mop up the floor, but if you never fix the issue, the source of the water going onto the floor, the flooding continues, right? So, this is the foundation of how I approach healing through the Healing Continuum method. It's a 5-step program approach to healing. We cannot fully repair a system that does not first feel regulated, which is what we talked about. And that's why the first step in the Healing Continuum method is regulate. Because regulating the system changes the physiology of the system. And once the body begins to feel safe, it feels more resourced, it feels more nourished, it feels more supported, it often begins to shift naturally towards repair and restoration. Not because we force the body into it, but because we remove the barriers that were preventing true healing from happening. If this video resonated with you, let me know in the comments. I'd love to hear your health issues, where you might feel stuck, where you can know the difference in your own body between the upregulation and the downregulation and how it makes sense to you. And if you want a deeper conversation around hormones, nervous system regulation, oxidative stress, functional medicine, and whole body healing, please subscribe to the channel. Thank you for being here.